Hello and good morning. My name is Chennisi. I am co-director of Healthy Living Matters with Harris County Public Health and a member of the city's Changing Diabetes Houston core team. I am excited to be your host for this episode of the live stream show, MyDiabetesHQ Live. Mental health care is an important part of diabetes care. During this pandemic, people with diabetes are especially vulnerable. Today, we will discuss the mental health challenges during this pandemic, coping mechanisms, and the importance of seeking support. Today's episode is coming right up. You don't want to miss this. Before we begin, a gentle reminder. The content shared during the MyDiabetesHQ Live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding any medical condition. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers in Houston and Philadelphia. Our two cities are the U.S. members of a global network of 36 cities working to improve diabetes prevention, care, and management around the world. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.com. The purpose of MyDiabetesHQ Live is to help people with diabetes and their support teams. And today we're talking about lived diabetes experiences and the effect that COVID-19 has had on mental health. I am joined today by my colleague from Harris County Public Health, Sarah Bogard. She is our Mental and Behavioral Health Programs Manager. In addition, we will have our Houston panelists of people living with diabetes. Serena Valentine is CEO of Core Initiative, lead for peer support in Cities Changing Diabetes Houston, and member of the Cities Changing Diabetes core team. We also have Reva Verma, CEO of Reneka at Builders and longtime tireless volunteer for Cities Changing Diabetes and the American Diabetes Association. Welcome to our panel today, and thank you guys for joining us. I'm going to begin by asking questions of those of you with lived experience of diabetes, and I want to start with Reva. Reva, as a person living with diabetes, and given this current situation with our COVID-19 pandemic, what stressors have been added to your life, especially, given that you are, as a person living with diabetes?
So the COVID-19 pandemic has definitely been very stressful and anxiety provoking. I think, the main general thing that has been a driver of the stressor is the fear of the unknown. We don't know a lot about COVID-19, and it seems like the information we get is constantly changing as far as precautions, things to be aware of, quarantining, testing, vaccinations. The list goes on, and it's just like there's no real standard to abide by at this point. So I think the fear of the unknown just compounding with that you're a high-risk person is extremely scary, to put it quite frankly. It hasn't been easy for me in the past year, and it's crazy that we're coming up on a year of dealing with this pandemic, and it doesn't seem to be going away. And so I think we've kind of had to shift our mindset of it's not going away, so how am I going to integrate this fear and anxiety and stressors into my day-to-day life so that I can still exist and live like a mentally stable lifestyle without freaking out about every little thing, because diabetes is a 365-day job, 24/7. We don't get a break. So to deal with just knowing you're high risk it's just been scary, And then, so the way I've dealt with it is trying to, do the simple precautions of limiting who I'm in contact with, making sure that I'm as healthy as possible to make sure that, you know, my blood sugars are as stable as they can be so that my immunity is up. Making sure that I'm washing my hands, doing virtual meetings, you know, just doing the day-to-day precautions that I can without going down this spiral and rabbit hole of being like, well, if so-and-so has COVID and, you know, how long do I need to quarantine? What if I never get a vaccine, which I did. I am lucky that I am one of the people that was able to get the Moderna vaccine. But, you know, I know a lot of people who are dealing with chronic conditions who haven't been able to get a vaccine, and it's turning into this Hunger Games mentality. So, that's been stressful. So I think as we've gone through the pandemic, we've learned how to deal with it, right? But if we back up a few months when vaccines weren't a thing and we were, you know, having high rates of COVID close to us, I personally experienced, I live with 3 other people in a house, and all 3 of them got COVID. And it was very stressful because I had been living with my parents through the beginning of the pandemic because I was worried as a high-risk person. I didn't want to, I felt like I was a burden and it was unfair to expect the people I lived with to make the accommodations that I felt I needed to live a safe lifestyle during the pandemic. So it's not funny, but it's kind of funny. I decided, okay, I have a grip on this situation. I'm going to move back into my house with my roommates. Literally within 24 hours, one of them test positive. And then it was like right at boom, 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 the other 2 tested positive. So then I had to quarantine. I was getting tested. I literally turned into a gypsy because I couldn't go back to my parents because they're older. We have my grandmother. It's a high-risk situation if I were to test positive to bring that into the house. I couldn't stay in my current house because if I was negative, I didn't want to increase my exposure to people who were positive. So, you know, I was bouncing around from people's houses that were negative and quarantining in their private areas of the house, and it was so stressful. I can't even explain it in full detail, but you know, I feel bad for people who haven't been able to even like see their families this year, and like, you know, people need that human interaction to feel supported and mentally stable, and we don't have that. Sure, you can be on FaceTime, sure you can be on Zoom, but it's not the same as that human interaction and empathy. And so I think it's about just continuing to do what you can do and focus on the things that you can control, like get out there for fresh air, do as much virtual stuff as you can. When you have the opportunity to get the vaccine. Just be a support system for as many people as you can so that you can preserve your mental sanity. I think that's been my experience with the stressors of COVID.
Reva, thank you so much for sharing that. Serena, how about you? How have you been coping during this very stressful time, especially living as a person with diabetes?
Coping. Okay, I don't even know where to start. Well, first of all, as soon as the pandemic hit, the schools were out, everybody was out, everybody was kind of at home, and the routine flipped, you know, because you know, I had a routine of what I did in the morning within the first 30 minutes of waking up and all of these other things, and then it became different because now I wasn't taking my son to school and all these other things. Everything just kind of flipped. And so it's been kind of touch and go when it comes to for me personally, my routine. And so it had been a little difficult to keep up the management stuff, like the diabetes management stuff. Like now it's like every day I got to see what's going to happen during that day and then try to plan my day in the morning instead of being like, okay, I know I do this every day at this time. I'm just going to do it every day at this time. You know, stuff like checking your blood sugars in the morning, taking your vitamins, taking your medications, eating breakfast, and then eating lunch, and you feel your sugar's feeling a little low, so you gotta make sure you stop and eat a snack, but sometimes you can't stop. I have a virtual learner here at home. Okay, he's in the 6th grade, but he's special needs child. He has autism, so I have to sit with him at the computer to make sure he stays on target. So the kitchen table looks like a school desk / work desk / I eat in that corner and only that corner because I didn't want it to get over here by the computer. It's just like balancing work and home and diabetes, you know, all at the same time. There's been times, I'll be honest, that I forgot to take medication. And it hurt my feelings because I'm like a routine type person. If I know at this time and this day I take this, then I expect myself to do it. Y'all, I have an iPhone. I keep all of my alarms on for everything. So when the alarm goes off, I'm like, okay, time to do this. And when you get to the point where you don't even hear the alarm anymore, because you have meetings going on here, you got a child and their teacher talking over here, and you're trying to keep up with both things, and it has been crazy. It has been crazy. And so not to mention the vision challenges that I've had. I've already mentioned this on another show. I have to learn how to keep things in one space. If it's moved, there's time taken away from my day to find it if it's moved. And so where I live with my mom and my grandmother. So I'm like, okay, y'all, wherever I put that, leave it there. Just leave it there. Don't touch it, because if I forget, you know, especially like where all my supplies are for my blood glucose monitor and stuff like that, the medicines that don't go in the fridge and all of that stuff. So it has been stressful. I've been able to make it, and trying to maintain a healthy diet actually to me has been a little easier because we're at home, and so I've been able to cook and not go out to restaurants. Now sometimes I might do that, pick something up and come here, or get somebody to deliver here if I'm really tired and just don't feel like cooking. But it's been easier to sit and make the choices that I need to make. Exercise I do at home. I work out because there's plenty of apps on the TV to access for workouts, and I can do that. And so it has been a big change, and it might be a while before things get really back to normal, but it has been a different, I would say to me, it's been a different kind of stress, not necessarily a different level, because, you know, you deal with things and you learn to deal with them, but then you get something else added and it's like, oh, okay, here we go with something else. So yeah, that's what I would do.
Well, Serena, thank you for sharing that. And luckily, it seems like you're a very self-motivated person, which is great, because it's really hard. I know individuals, if they're not self-motivated, it's really hard to find the drive and the desire to do those things at home. Speaking of the experience from others that you support, like the individuals in the peer support groups, what are you hearing from them as far as the challenges that they're facing during the COVID-19 pandemic and how it's affecting their mental health?
Actually, I've heard a lot of what Reva just got through talking about, oh my gosh, now I have diabetes. So what am I going to do if I get COVID? Am I going to die? Should I take the vaccine? Should I not? I hear everyone's having side effects with the vaccine. I have diabetes. How is that going to affect my diabetes? Just fear of unknown, not knowing what's going to happen next. And like Reva said, the information changes often. So it's like, okay, I got to know which sources to trust and which sources not to trust. Because, we hear a whole lot of theories and things going on. I also hear it's hard to stay on the regimen. Like I was mentioning, the routine. You may get on track for a while, and it's easy to just slip back in, because if you're at home a lot, home is home. When you're able to leave the house, you can tell the difference because you're going to work or going somewhere else. And when you come home, home is home. And it's kind of hard to balance that because you're just at home and you're like, okay, let me get focused and let me try to exercise. And some people have been iffy about going to the gyms, even walking outside in the parks, especially the parks that are highly populated with people walking. They're like, okay, so do I walk in the opposite direction? If I walk up on somebody, do I pass them up really fast? Do I at least run past them and then I can slow down and walk? All these things I'm hearing in peer support, and it has generated lots of questions.
Well, I'm very glad you mentioned trusted sources. Speaking of one, your local health department. So I'm going to turn it over to Sarah for some quick questions about resources and the work that we are doing at Harris County Public Health, but I'm sure others in other communities are doing similar work. So Sarah, in addition to the things that Reva and Serena have mentioned about, why it's so important to focus on mental health during this pandemic, why is mental health such a priority for Harris County Public Health?
Right. So the reason mental health is such a priority right now is because from a public health lens, we look at mental health in terms of a continuum of physical health, prevention strategies, and we try to do it at a population level. And for me, I started here in June, and my experience is always working with individuals after the crisis has happened. And so with COVID and hearing the things that Serena and Reva were saying, what we know is that individuals are uncertain. Our routines are messed up. There's fear. There is a sense of lack of control. All of these things can negatively impact our mental health. The way we look at mental health is on a continuum in terms of everyone has it. You're either at one end of mental wellness or you're at the other end of possible mental health diagnoses and more serious mental health symptoms, but everyone has mental health. And so just hearing just the things that have been said so far, just those things push you more towards one end of the spectrum in terms of, maybe closer to mentally unwell. But it sounds like there's also things that have been put in place that are simple that can help bring that balance back. And so making sure that everyone finds a way to take control of their life or their routine, even if it's the smallest thing, like making your bed in the morning or cooking dinner, things like that will bring you back towards a sense of stability. At a population level, what we know is there has been an increase in individuals who have died from suicide. We know that there has been an increase of individuals having overdosed. And from a public health lens, we have to view that in terms of our ability to reduce stigma, our ability to identify risk factors, our ability to promote prevention strategies, which would involve sharing resources with our community members. And so from a public health lens, so those are some of the things we are attempting to do in order to reduce potential crises from happening. Individuals with a pre-existing medical issue or diabetes, there is an increased fear of the consequences of COVID if you get it. There's an increased anxiety of, did I walk in the park next to someone who has COVID? Did I get it? My mom has a immunodeficiency issue, and she recently got diagnosed with that. And so I fear for her. I don't even want her to go to the grocery store. But on the other hand, we can't take away someone's sense of taking care of themselves. And if we take all of that away, the negative impact that has on one's mental health, it's a difficult balance. And so from a public health lens, those are some of the things that, we are looking at, learning how to better address those issues.
And Sarah, what are some of the supportive services that are being offered currently at Harris County Public Health to assist with mental wellness, or other, partner organizations in the Houston-Harris County area?
So I'm a huge proponent of peer support. Like, I think peer support is the most amazing tool that we have. And a lot of times, unfortunately, people just associate it with substance use. We just see it as an AA group or an NA group. But the fact that there's diabetes groups, there are groups for individuals who are experiencing depression. There's groups for individuals with bipolar anxiety disorder. For someone who is not sure if they are ready to actually seek treatment through like a psychiatrist or therapist, that would be an amazing place to start, just to talk to others about what they've experienced, get more comfortable with what therapy might look like or where to go for treatment. So I think number one is peer supports, whether that is, one good thing that's come about from COVID is we have made it as easy as possible for someone to join a peer support group. There are all types of apps on your phone if you just search it. And that might be an amazing first step to get connected to treatment or better identify, what exactly you're experiencing. And back to your initial question about Harris County Public Health, we have recently started providing teletherapy to individuals who are experiencing mild to moderate mental health symptoms. We are not, and in order to reach those services, I believe there's going to be an email address that we share with you. And so if anyone has any questions about resources in the community or where to go for education, please email us and we will get back with you. Some other amazing resources that not only we have in Harris County, but all counties have local mental health authority. And in Harris County, that is the Harris Center for Mental Health and IDD. And if you do not have access to quality medical insurance, that would be a good place to go for treatment. Every county has that, whether you're in Harris County or anywhere across the country. Mental Health America is an amazing resource. NAMI is an amazing resource. And so just educating, I hate to say it this way, but one way is just search the internet. You can find a lot of amazing resources that way as well. And talking to your doctors, if you are experiencing symptoms where you're not feeling motivated to take your medication or you're forgetting, mental health, you treat it just like you treat diabetes. There are strategies you put in place to where it is being managed. And if you're not managing it, it could quickly get out of control. And if you're treating your diabetes, but you're not treating your depression or anxiety, that could quickly snowball into an effect that, I don't need, what's the point of taking my medication? Or, I'm not feeling good. I want this food. I'm just going to get it. So you have to take care of both at the same time, or, things will quickly get out of control. So find what works for you, a recovery plan. And so, yeah.
All right. Thank you, Sarah. Thank you for sharing. And I'm glad you brought up peer support and peer support groups. I want to ask Serena, as our local peer support champion, how does one connect with your peer support group?
Okay, so we have a couple of ways. Okay, we have a group on Facebook. So if you go in the search engine and type in on Facebook now, Houston Diabetes Peer Support Program, and click on there. Click on y'all see the logo with the hands and the heart and everything. Click on that and request membership, and the admins will get right to you. Also, we just started offering one-on-one peer support as well. And that's another thing due to COVID. Some people are still not group people. Whether some people like being isolated, they like being alone. So because of that, some people do not want to do the group setting for peer support. And so we do offer, I've got a few people that I offer peer support to on a weekly basis by phone call. You know, especially the older adults who don't want to use a computer, they don't want to get on a Zoom call or Teams call or anything. They're like, oh, that's too complicated, I'll just call you. So yeah, so we're trying to make different ways so nobody has an excuse not to get the support.
Serena, has the demand changed with the way the pandemic is right now? Are you seeing more people interested in being a part of a peer support group, or as you said, just doing it differently?
Yes, definitely. Our peer support group online has really grown since the beginning of the pandemic. And what I've been getting a lot is that, well, I need some kind of interaction. And social media provides that. You know, a lot of people, you know, social media comes with some negative connotations for a lot of people, but it seems like with the pandemic, it has been seeming like a way for people to connect with other people who, you know, it might not be your neighbor. They might not live next door to you or be down the street from you. They may be across the country, but that connection with that person kind of helps the being isolated and feeling like no one cares about you and no one knows about you because you're in the house alone. You know, social media has been a really good tool to use, you know, during this time.
Wonderful. Thank you so much. All right, so I have a question for all of you, and I'm going to start with you, Reva. Reva, what is one thing you would recommend that all people with diabetes do right now to support their mental health?
That's a really good question. I would say if you could do one thing is try to just stay consistent with your blood sugars, whether that's keeping your sensor on or sticking your finger, but just trying to do that one thing consistently, because just that awareness of knowing where you are helps the motivation factor, I think. That would be my one thing.
Wonderful. All right, Serena, your turn.
See, I'm a fairly complicated type of person. One thing to me is like, oh, one thing, what do I choose? But one thing I would say is to do not stop seeing your doctor. Even if you have to, like my last checkup I did last month, I saw my doctor do telehealth. And then I actually went to one of the lab places to get my blood drawn so that, you know, my A1C could get checked and all of that stuff. But if you know, you feel funny about actually walking into a doctor's office, at least check with your doctor online, whichever way, telehealth, and at least go and still get your, you know, every 3 months or every 6 months or once a year if you're really a champion on your diabetes. Just make sure you continue to get those checks, because those are very important, because time can pass by and you're thinking nothing's wrong. I feel good, but we all know with diabetes, you may not feel what's going on in your body, but there could be something going on that can lead to something very devastating. So I would just say, keep your regular checkups going.
Wonderful. And then Sarah, what recommendation do you have if there's one thing you think people should do right now to take care of their mental wellness?
One thing, just one thing. I think the one thing that is extremely important for everyone to do right now is take a little bit of time every day and do a check-in with yourself. You know, if you're thinking about, I haven't spoken to anybody in 2 days, or I haven't gotten dressed out of my sweatpants for a week, or you look around your house and things are in disarray, take time for yourself to check in with where you are, because it could be a reflection, of possible depression symptoms or anxiety. And I'm going to say but I'm not adding another thing. It's still tied to this one thing. And then find one thing you can do to respond to that. For example, call someone today, or make a plan to call tomorrow. And don't overwhelm yourself by trying to take care of it all at one time, because that will be too much. And if you don't get everything done, it might reinforce, your sense of depression and anxiety, things like that. So don't overwhelm yourself either.
Great. Sarah, a lot of times we hear about the challenges with mental health, mental wellness being around the stigma that exists, and individuals having a difficult time talking about their mental health. Some of the great suggestions we heard from Reva and Serena were about talking to your doctor. So what recommendations would you have for individuals to talk about mental health and mental wellness with their doctors or with others? How do we eliminate the stigma?
I would hope doctors check in with you. Are you sleeping? Have you been feeling more down or depressed lately? If they don't, bring it up to them. Tell them, I've been having a hard time sleeping. I can't sleep at night. My mind is racing all the time. Or I feel so much anxiety. I'm so worried that I can't get out of my house. Or I feel a lack of motivation. Or I used to enjoy doing this thing, and now I don't. Talking about it is no different than talking about your diabetes symptoms or any other medical symptom. It's the same thing. And I think that's the biggest challenge we have in talking about mental health, is that it's shunned. There are cultural issues involved. People automatically associate it. I'm crazy, or I'm not crazy. I don't have a mental health issue. I'm not crazy. But going back to the fact that everyone has mental health, it has nothing to do with crazy. It has to do with you advocating for yourself, your mental and physical health, and talking to your doctor, or even to reduce the stigma in the community. You talk to your friends and family about it. Or if you hear someone use the term crazy or addict, confront them. We have to confront stigma in order to get rid of it. And so those are some things that I might suggest.
Great. Thank you so much. I think we received a question in the comments. Let's see. This individual, Ms. Tawanda, mentioned that she was diagnosed with prediabetes and would like to join a support group on Zoom. Can we help with that? At times feeling sad, trying best to prevent this, and sometimes, she doesn't care. So is this something, that's common? How do we connect individuals like Ms. Tawanda with those resources?
Shameless plug, go to Facebook. Ms. Tawanda, listen to me. Go to Facebook, go in the search engine, type in Houston Diabetes Peer Support Program. I will see your member requests. I will admit you, and then we can talk about what's going on. And, our peer support group isn't an end all be all, but if you need other help, we can connect you to other people and other professionals that can help you.
Thank you, Serena. And as Sarah also mentioned, we have, Sarah and her team have an amazing resource guide of local Houston, Harris County area resources for anything related to mental health and mental wellness. So we will gladly share those resources as well. In the Houston, Harris County area, we have a very robust 211 resource and referral system also. So if there's the easiest thing to remember is the number 211. They have, operators standing by to pick up the phone and just say, hey, how can we help you? What is your need? And connect you to those resources as well. So there are many avenues for finding support, but thank you guys for sharing those that you know of. We are now at the end, unless there's anything else. Serena, Reva, Sarah, you guys would like to share?
Yeah, I did want to say it's really hard to identify what you need, It's really hard to identify, if you're depressed or you're feeling anxious, where do I go? Where do I even start? And so I know we were talking about yesterday, maybe doing an additional session on the types of services available. There's medication, there's therapy, there's support groups. Where do I even start? And so for individuals who are trying to find out more information about that, just in terms of where do I go, what do I need, please feel free to email us. And if not, I really firmly believe that a support group might be the best place to start, because just because you're feeling anxious or depressed or, down, that doesn't necessarily mean it's out of context with what you're dealing with COVID and your medical issues. And so that might be a good start, and it might take care of, what it is you're experiencing. So I just also wanted to mention that.
Great. Thank you, Sarah. Serena, any final
yes, thoughts? I'm sorry. I didn't mean to interrupt you. I just wanted to say very, very briefly, when it comes to the stigma, and we talked briefly about how to dispel that, it would also help for people who are actually dealing with these things. Once you get help, go help someone else. You may not help a whole group of people, but if you go help one person at a time, because a lot of times people won't talk because they think they're the only ones dealing with it. And that's what I dealt with in peer support. I put so much of myself in there. Some people are like, wow, you just tell your business. I don't think of it as telling my business. I just think of it as, well, somebody else might be dealing with this same thing. And I remember feeling like I was by myself and I was the only one. And that's not a good feeling at all. So to more normalize it by talking about it, if you're dealing with it, or if you dealt with it and you've overcome, go help one other person that might need that same help. And it'll cause a ripple effect. If everyone helps one other person, and then, that translates over into your daily life. It doesn't have to be diabetes. It could be anything. Death of loved ones, because a lot of people have been dealing with that during the pandemic. And so if you've been dealing with that and you feel better, you're doing better, go tell someone else, go talk to someone else about it, so that they won't feel as shameful or anything like that when it comes to things of that nature. It'll be more normal, like, oh, well, such and such has been dealing with it, so maybe it's not as weird as I thought. I'm not as weird as I thought I was, so.
Just piggybacking off that, as a, I ate lunch in the bathroom in high school because the anxiety and depression I had were so bad. And so I've been on psychiatric medication. I've received therapy. And so as a way to normalize it, we have to talk about it, as exactly as you were saying. And so I think the more we talk about it, the more open we are, the more that we see 1 out of 5 people have a diagnosable mental health issue. And so I'm one of them. And so there's nothing wrong with talking about it or seeking help or admitting it, So thank you for saying that.
I couldn't agree more. And I also want to just add that, COVID affected everyone. It didn't just affect a segment of the population. Everybody's lives changed. So when we put it in that perspective, it's really important to focus on the things we can control and make just small obtainable goals for ourselves, and instead of trying to just do everything all at once. If we can get to the point where we make small daily goals or small weekly goals, instead of trying to say, I need to get all of this done in the next month, I think it helps our mental state of mind, definitely.
Absolutely. All right. Well, we have a quick survey. First of all, I want to thank you all for your amazing perspectives and sharing such amazing resources. We know they're invaluable to those who are watching and will be watching in the future. I do want to inform our audience that we have a quick survey on YouTube and Facebook where we would like to get your feedback on the program as well as recommendations for future episodes. Please make MyDiabetesHQ Live better by filling out our survey. It's been a great way to start a Saturday morning with yet another talented panel of guest speakers. To our viewers, we hope that this morning has opened your eyes to concerns related to mental health care and wellness. We hope that all of you will raise your voices and help change the narrative around mental health and reduce stigma. Mark your calendars. We will be broadcasting every Saturday at 10 a.m. Central Time and 11 a.m. Eastern Time. Our next episode will air on Saturday, February 20th, when we will hear my Harris County Public Health colleague and Cities Changing Diabetes volunteer, LaPortia Carter, host a program on caregiving. Thank you for being a part of the My Diabetes HQ community, and we hope to see you next time.